Christina. I went in for a tummy tuck and I came out with some unwanted curves. I have 4 kids, all boys. They're the best things ever, but they do keep you busy. Before I had kids, I had a very slender, small physique. And then I had my first child and I gained 60 pounds and it just sort of skyrocketed from there. I got up to 192. My cholesterol was 251. The doctors were becoming concerned, so that was making me concerned because I have 4 kids. I cannot take the risk of having a heart attack when I can fix this. I had decided I was going to do protein shakes and then eating healthy and clean and working out every day. I thought that weight would just come right off, and really it didn't. I only, in 1 month, lost maybe 3 to 5 pounds. So I got really frustrated and I talked to my husband and we had decided we were going to go see a plastic surgeon and get his opinion on what I should do. The consultation with this doctor actually I thought went well. I mean, he told me everything I wanted to hear. I would have a tummy tuck and lipo of the flanks and the back. So I believed him. I believed that my decision was the right decision. After surgery, I was in the recovery room. I had sneezed and I felt this pop and this pain in the top part of my abdomen. And I instantly had said, oh no, something is wrong, when I went in for my 1-week check. As soon as they took the compression off, the pain was massive. I had a huge lump in the top part of my stomach, and then my side had this huge indent. I did bring it up to the doctor, and he had said it's totally normal, just give it time. I mean, I was in pretty major pain for months straight, and then my side never loosened or popped back out. So I felt like, what a waste of money. I just felt stupid and embarrassed that I did this to myself.
Reach forward a little bit, and as you inhale, reach that hand up and back towards the back of the room and slide the left hand down. And then commit to this lunge in the knee. Good.
This is definitely pulling a little bit too much of that one spot.
Okay, let's come on back up.
When I was at my heaviest weight, I felt miserable. I let this plastic surgeon take me for a ride.
So you've been living with this for a really long time.
Yeah. I mean, emotionally, it's terrible because I feel like, you know, my kids deserve more.
I understand. That's really understandable.
The kids are Kristina's world, and anytime she can't do something 100% for them is hard for her.
I just feel like here I am not being able to do the stuff I wanted to be able to do. So I did have a second opinion, and he had said that there wasn't a whole lot that could be done. So I feel like Dr. Dubrow and Dr. Nassif are just really the only ones at this point who can fix me.
My name is Terry Dubrow. Look, hold on. My name is Terry Dubrow.
Isn't there something weirdly refreshing about doing that, though?
I know I'm always teasing Terry about using these little flossers, but it's kind of relaxing and it feels good.
Isn't that good? Don't you like that? Clean those teeth. Yeah. There's something good about it, isn't it?
I can imagine you. Patient walks in the room. You forget that you're flossing your teeth.
I've done it. I go like this, I go, yeah. And all of a sudden I realize it, and I'm fully like, really? Do you want your surgeon who specializes in beauty to have gross teeth? Yeah, I don't think so. I go.
Not only can Terry be the king of erectile dysfunction, he could also be the queen of oral fixation.
Our next patient is, her name is Christina. And Christina has a number of complications related to a tummy tuck she had. Have a look. So what you notice are these bizarre dog ears.
Yeah. Is that what that is?
Yeah, these are sort of
Okay,
large
really
dog
tell.
ears and this shelfy appearance, particularly in the right hip. And then look at the central area.
Is that a big hernia?
Or the repair of the muscle broke down. So let's bring her in and see whether we can help her.
Can you please send in Christina?
Hi, how are you?
Christina, Dr. Nassif.
Nice to meet you.
Yes, Joe. Joe, nice to meet you.
Today I'm definitely feeling nervous because I feel like Dr. Dubrow and Dr. Nassif at this point are my only chance of making this look normal.
So take us back and tell us how this all happened.
The goal was always a tummy tuck, so I wasn't sure if I should do it before weight loss or after weight loss. And this doctor assured me he did many where people had lost 50 to 70 pounds.
He said it's okay to have a tummy tuck and then lose 50 pounds.
Yes.
Really?
Yes.
Normally, we tell patients to lose weight before having a tummy tuck because if you do it after, it'll significantly loosen up your stomach.
In the hospital, right after surgery, I had sneezed, and I felt an
Pop?
overwhelming amount of pain in a pop. And I brought it up immediately. They're like, oh, no, there's no way you could damage this surgery.
So what happened?
It was really very painful. I said, what's with this? So then he sort of gets annoyed with me. And he's like, well, there's nothing we can do right now. You have to at least wait until the 1 year mark. So for the 1 year check, he comes in with his iPad and he shows me my before pictures. Look how much better you look. And right then and there,
You knew.
red flag.
Yeah.
I was just like, oh no.
The doctor who took care of Kristina was grossly irresponsible. He should have addressed the pain issue.
We have to do a physical exam
Okay.
and see what's going on.
Okay.
Yeah.
I'm scared I'm gonna get in there and they're gonna tell me that there's nothing that they can do to help me.
I was thinking about getting my chest bigger.
They're already huge. Like, that's all I look at already. You have to save room for your face.
Okay, so yeah, let's start with the rib. Reconstructing an entire nose is like building a complete house. Now, what is that?
You have this area that's pooching out.
That's where I felt when I sneezed.
You
and,
clearly have a separation of the muscle here. Secondly, you do have more sort of pelvic bone sticking out here than you do here. See that there?
Oh, yeah. I mean, there's a huge discrepancy.
Huge bony discrepancy.
Okay.
But what has made that even more significant is the fact that you have all of this soft tissue here
Okay.
that was left after the tummy tuck.
Yeah.
So there is this chunk
Yeah.
here that could be removed and improved.
Now, what about like right this? See, because if you look at it from, can I just take this?
Yes.
That over-aggressive lipover.
Yeah, exactly. In general, we don't lipo this far up because this is actually the blood supply. He got very lucky that his abdominal skin down here and that it healed so well, which it did. When tissue doesn't have adequate blood supply, it starts necrosis, which is a fancy term for cell death. I think this is definitely improvable. This is fixable. But at the end of the day, I don't know what's causing this pain. I have a feeling it could be improved, but let's talk turkey for a minute, okay? If we do a revisional tummy tuck, remaking this incision, going further back to remove this excess skin and soft tissue, re-elevating up the abdominal wall, putting it back down. Now here's the turkey part. This is no joke. When you tighten up the abdominal wall, it can squeeze down on the pelvic venous system, which is the return system of blood from your legs, and can give you a blood clot that if it breaks off and goes to your lungs, that is when people die from plastic surgery.
That's no good. They are real risks and they make me nervous, but I need to get it fixed because it's a huge thing to live with the fact that I did this to myself.
What do you think, ma'am? Okay, I don't care.
Don't you love it?
I'm
You
used
gotta
to
be
it.
used to it, yeah.
Used to it for many years.
So you think you want to do this thing?
I think so.
She's on board, I'm on board.
So you need some help, and we're here to help.
Thank you.
Yes, thank you. I know there's a chance it may not look totally normal, but I'm going to improve myself for my children and my husband.
Pleasure.
Thank you.
See you guys soon.
Hey, Terry.
Hey, how are you?
Good to see you.
It's been a long time. Good to see you. Dr. Lesavoy has been my mentor, and he's actually the reason I went into plastic surgery. You never age? How come I've gotten older, but you still look the same? Dr. Lesavoy is a Renaissance plastic surgeon who really cares about the patients, and he's just really cool. I was a second-year med student, and you walked in those cowboy boots. We all said, whoa, okay. Did you have the boots on, the cowboy boots?
Yeah, sure.
You still got the cowboy boots on?
I don't own any shoes.
You don't remember this, but I followed you out, and I go, hey,
Yeah, you were trying to kiss my ass.
I was trying to
can
kiss you.
imagine. Yeah.
It worked, right? I ended up spending 7 years in a laboratory with you.
Yeah. There were a couple times when I had to save your ass with the other faculty, you know?
Yeah.
Because of your personality, kind of brashness and everything else.
Little brash.
A little brash.
Dr. Lesavoy has seen and done some of the most difficult cases that have ever been reported. So he's a good resource when I'm dealing with unique and original problems. The reason I asked you down is because patient's 38 years old, had a tummy tuck, and post-operatively she noticed a pop and immediately saw swelling. But she also has had chronic pain in that area.
Okay.
You know, I'm a little bit at a loss.
We have like 3 or 4 or 5 different options of what we could find.
Right.
Either way, it's pretty possible that we could fix it.
Right.
But here's the thing in plastic surgery, you know, it's not technically what you do with your hands, it's what you do with your head. Think out of the box.
Right.
And you're always thinking out of the box.
Always.
Yeah, except your skull is so hard, I don't know how you can think out of the box.
You want to go meet her?
Yeah, let's go.
All right, let's go in. Kristina, how are you?
Good, how are you?
Good to see you.
Good to see you.
This
Hi.
is my mentor,
Nice to meet
How are you? Nice to see you.
Dr. Malcolm Lesavoy. So any problems that you have, you can blame him.
I'll take the blame.
Dr. Lesavoy is the premier surgeon for difficult problems who taught me how to do difficult problems. So your problem
Thank you.
is so unique, I thought I would do something special and bring my mentor
Oh, that's awesome.
to help us
That's
today,
really
okay?
cool.
All right, where's the bartender?
Only if I could have one too. I'm definitely feeling nervous, relieved actually, excited. I'm hoping, you know, today's gonna be the day everything gets fixed. So I'm hoping from here on, the pain will be relieved.
This is gonna be cool. I'm interested to see what
Right?
we find. Yeah.
You know what? No matter what everyone says about you,
Yeah.
you're a great guy. I will begin Kristina's surgery by making an incision on the lower abdomen from hip bone to hip bone. I will inspect the area just below her chest bone to see if I can find any visible cause of her pain. Then I will repair her ab separation by sewing the muscles together. Lastly, I will remove the excess skin on her sides to make both hips symmetrical.
Are you ready?
I'm ready. Are you ready?
I am. I'm excited to find out what was wrong with my abs.
Yeah, I think everything's gonna turn out great.
I hope so. Yesterday, after waking up and then even going back to the hotel, I did not feel any type of pops. Everything felt like it's where it should be.
So, how do you feel?
Much better than the last time around.
Okay. We made an incision, opened everything up. You have what we call a presumptive diagnosis of nerve entrapment.
Okay.
Which you really don't see because that's on a microscopic level.
Okay.
So lifting everything up hopefully will take care of that.
Okay.
When I've done this in the past, more times than I can count, it's almost always fixed the problems.
Okay. I have a little bit of fear because they couldn't figure that out, but like you said, lifting the skin up should reset those nerves, so I should be good.
Normally, when you have a separation of the muscle,
Yeah.
someone who's had a pregnancy or two, it's about this. It's about 10 centimeters.
Okay.
When you go back on a revision tummy tuck and you still have a separation, it's never 10 centimeters. She had like 12.
Oh, geez.
So maybe it just never got done?
No, it was done because you could see the stitches had unraveled.
Yeah, that's right. You thought you popped.
Yes.
Right.
Because I sneezed. I knew right from the beginning that that pop did something. So I feel validated that Dr. Dubrow took me in and listened to me, and he said, definitely it was popped, it was separated.
What was very interesting though is because the lower muscles repair was still intact, it was like acting as a belt here, compressing here, pushing this out. And then the shelfie area was interesting because part of it was due to your
Bony, yeah.
bony asymmetry, and it was very scarred down. So along the crease in here, I basically tucked it up into the crease. So
You
let's
did,
see
okay.
what it looks like. I'm really happy with the way Kristina's surgery went. Now we'll just have to wait to see how well she heals. She has a little swelling here, but that's from the liposuction. This is the area you worry about.
Okay.
And you can see it looks like the blood supply is delivering oxygen and it looks happy as a clam.
Absolutely fantastic.
Yeah, I
Thank
think
you.
Nailed it, my friend.
well, I mean, you've got a long recovery to go through,
Yeah.
but right now we're in a good place.
I'm very excited that Dr. Dubrow was able to correct what went wrong the first time around. I felt like I was definitely in good hands. No more sneezing.
No more sneezing.
No more sneezing. This whole experience has been life-changing for me, really. Since my surgery, I've been 100% back to my old self with confidence I have not had before.
So do you guys want to challenge Mommy to any games?
Yeah.
Oh yeah, what game are you going to challenge her to?
Hula hoop.
I don't know, I bet Mama's pretty good at hula hoops.
So am I.
Today is so special for me because I get to show Joe and show the kids Mommy's back and better than ever. Hey guys, how are you? Look, I brought
Mommy.
snacks. How are you?
Good.
Did you guys set this up for me? You guys did a good job. Do I look pretty good?
Yeah.
You look
Yeah.
fantastic.
My self-confidence has definitely boosted. I am able to wear more tighter, form-fitting clothes. I look in the mirror and I'm thrilled to see myself. So how crazy that I can wear this kind of clothes again, right?
They look fantastic.
Thank you.
How you feeling?
I feel good. Before my surgery, I had this bulge on the top of my stomach, and it looked like a huge chunk had been scooped out of my right side. Now, thanks to Dr. Dubrow, my stomach is flat, and I have curves in all the right places. Ready? Go.
This one's way too big.
I have no pain, not one bit of pain anymore, which is awesome.
Got any outfits you have already picked out?
Maybe. You're gonna have to just wait and see. I did. Oh!
Jeez.
I'm sorry, knee, are you okay? I have nothing holding me back. And as a parent, I feel like I'm a better parent. I can't change what happened in the past. I can't change the time I lost with the kids, but now I can make up for all of that. And I feel like super mom again. And it just makes me feel good. After we're done eating, I'm gonna get those potato sacks and I'm gonna beat you in the sack race. I'm gonna win. You didn't think I'd win the hula hoop? No, I did.
I won.
The hula hoop?
Yeah.
What picnic were you at?